We're at Transcatheter Cardiovascular Therapeutics 2019 conference at San Francisco at the Moscone Center. And I have the privilege of having with me Dr. Maurizio Taramasso from University Hospital of Zurich in Switzerland. Maurizio, welcome.
Thanks.
So we're going to talk about the presentation that you had today at the meeting, which was on transcatheter tricuspid therapies with a simultaneous publication in JACC. Tell us a bit more about the scope of this investigation, a bit of a background for the audience.
Yes, sure. Thanks for the question.
Sure.
So basically, the background is that we know since several years that the prevalence of TR is high in the general population. We know that it is associated with bad outcome in terms of survival and in terms of hospitalization. But actually, we are missing the evidence that any kind of treatment aiming to reduce TR could actually be translated in a clinical benefit. So we are collecting data on interventionally treated patients with different devices since some years.
Sure.
And they are putting this data in an international registry, which is the TriValve registry. And recently, we had the opportunity to compare the data of the interventional treated patient of our registry to a cohort of patients under medical treatment alone.
Sure.
And to do this kind of comparison with a propensity match analysis in order to try to prove whether in this kind of population transcatheter treatment of TR could be associated with any kind of benefit.
Sure. So just to summarize, this is not a trial, it's a registry.
Yes.
Of patients who are being followed prospectively.
Exactly.
In both arms, the ones who got transcatheter tricuspid therapy and then the ones who were managed medically. And then the propensity matching was done to match the groups well.
Exactly.
So what did you find? I mean, that's a great study design.
What we found is it was quite surprising. I am a believer of transcatheter treatment of tricuspid valve, but
Sure.
Actually we were able to show and somehow to demonstrate a great benefit in terms of both rehospitalization and survival. Actually, the primary endpoint was a composite endpoint of survival and freedom from rehospitalization for heart failure, and the secondary endpoint was overall survival. And in this specific study, the transcatheter treatment was associated with improved outcome with both primary and secondary endpoints. So better survival, lower hospitalization, and interestingly, looking at the patient who got TR reduction and comparing them to those who didn't get tricuspid reduction, so the one who had procedural failure, let's say, when we were not able to reduce TR, the outcome was exactly comparable to the control group. So this tells us that reduction of TR is really related to improved outcome. Of course, there is still a lot to do because these are not randomized data.
Sure.
These are coming from an observational study, as you said. But I think really we are now ready to move forward toward a design of a tricuspid trial, randomized one.
Yes, no, man, I think it's important work. It's always been referred to as the forgotten valve. As you know, it's the right-sided valve disease requires innovation and treatment because, like you said, there is an unmet need and there is a patient population that requires intervention. Describe to us a little bit about the technique itself, what was done, from a transcatheter standpoint.
Yes, the patient included in the registry got different kind of device. So it's a multi-device registry. Most of them got mitral with tricuspid position, about 80%. So I would say the vast majority of the patients. Sure. But we were able to capture also the other devices, so annuloplasty devices, other leaflet therapy, and also some replacement. So in this study, we compared also patients treated with mitral clip against other devices, and we didn't find any difference. The only, let's say, discriminant was procedural success. Mm-hmm. So the difference between patients who got improvement and patients who didn't was TR reduction, independently from the device which has been used. Okay. And in the future, we want, and this is the main objective of the TriValve registry, is to try to identify which kind of anatomy can be better responding to specific devices. But at the moment, we don't have enough patients and enough statistic power to really say this anatomy perform better with annuloplasty rather with the leaflet device.
Yes. So I mean, the data are clear that it was the common final pathway, if you will, of TR reduction led to a difference in mortality. Do you think the findings of the study would then translate into better iteration for technology, or are these grounds for, like you said before, conducting a prospective randomized control trial, comparing transcatheter tricuspid therapies, irrespective of the mechanism or the device iteration, with medical therapy?
Probably both of them. I think
Sure.
since the study clearly showed that TR reduction is associated with improvement, at the moment the device that we have are, let's say, not perfect in reducing TR, also because we are treating patients quite in an advanced phase of the disease where TR is really torrential.
Sure.
But having said that we need to reduce TR to get improvement, I really think that there is room for technological improvement to get better TR reduction. Mm-hmm. On the other hand, there is also room for better patient selection in terms of anatomy and also in terms of timing. Probably if we treat patients a bit earlier, we are able to reduce better TR rather than waiting for torrential, so-called torrential TR, where to get to a moderate or mild or even abolish TR could be really challenging or even impossible, at least with the current repair device.
So what are your take-home messages for the audience, from the presentation this morning, as well as from the paper? And if you could also summarize, what constituted medical therapy, I think that'll be an important take-home for the audience who are listening.
Yes, my main take-home message is that TR matters. Finally, we have a kind of demonstration that reducing TR is associated with improved outcome, and therefore this is a kind of stimulus for us to try really to define now who are the responder, who aren't the responder to transcatheter tricuspid valve therapy. Mm-hmm. But at least now we have some element to say that we are doing something good for the patient. It's not really a palliative therapy.
That's a good point. Yeah.
And safety profile, this is somehow already known, is quite good. They are really high-risk patients. If you look into the preparative characteristics of the patient, they are really patients that are not surgical candidates, so they have really no other option rather than diuretic therapy. Now we have something that is at least promising, and it's time to move forward in studying these kind of possibilities.
Great. Well, congratulations again for your work, and
thanks.
Thank you for talking to our audience.
Thanks for the question and for the opportunity. Thanks.
Thank you.